Bismillahirrahmanirrahim. Assalamu alaikum. Welcome. Today we will discuss an important aspect of the dental practice, that is managing dental patients during and after pregnancy. In this lecture, we will cover the special considerations needed to protect both the mother and the developing fetus. Pregnancy, while not a disease state, requires special consideration to protect both the mother and the developing fetus. The main focus is on preventing the genetic damage to the fetus, particularly through dental imaging and drug administration, ensuring safety and minimizing risks and crucial aspects of providing dental care during this period. Oral surgery during pregnancy should ideally be postponed until after delivery to avoid any risks to the fetus. If surgeries cannot be delayed, steps must be taken to minimize exposure to the teratogenic factors. Protective aprons should be used during the imaging, and the only medications considered safe for the fetus, such as lidocaine and penicillin, should be administered. This approach ensures the safety of both the mother and the developing fetus. Protective aprons should be used during imaging as shown here. Certain medications are contraindicated during pregnancy due to their potential risks. Non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen should be avoided, particularly in the third trimester. Sedative drugs and nitrous oxide requires careful considerations and should generally be avoided in the first trimester. Guidelines for the management of the pregnant patients and dental setting should be followed. These guidelines also provide the lists of drugs that should be avoided during pregnancy. This box provides comprehensive management of guidelines for a pregnant patient, and this box provides a list of medications to avoid, helping to ensure the safety of the pregnant patient and the fetus. The FDA has established a system for categorizing drugs based on their risk to the fetus. Category A drugs have no demonstrated fetal risk, while Category B drugs are generally safe but lack comprehensive human studies. Categories C and D indicate increasing levels of risk, with Category D drugs showing positive evidence of harm. Category X drugs have confirmed fetal abnormalities and should not be used during pregnancy. This categorization helps clinicians choose safer medication for pregnant patients. Pregnancy can be both emotionally and physiologically stressful, and an anxiety reduction protocol, including monitoring vital signs and blood pressure, is essential. Positioning the patient properly is crucial. Avoiding the fully supine position prevents compression of the inferior vena cava, which could compromise venous return and cardiac output. The patient may need to be in a more upright position or have her torso turned slightly to the left. Frequent breaks should be allowed to accommodate the need for restroom trips. After delivery, special consideration are necessary when providing oral surgical care to breastfeeding patients. It is wise to avoid drugs known to be harmful to the patients. Consultation with the child's pediatrician can provide additional guidelines. This table lists the effects of various drugs on breastfeeding infants, ensuring that clinicians can make informed decisions to protect the child's health while providing necessary care to the mother. To sum up, managing dental patients during and after pregnancy requires careful consideration to minimize risk to both the mother and the fetus. This includes following the guidelines for safe medication use, employing spatial positioning and anxiety reduction strategies during dental procedure, and taking precautions when treating postpartum patients. By adhering to these practices, clinicians can ensure safety and well-being of their pregnant patient and the postpartum patients. Thank you. Wish you best of luck.